first in the blood, after that in the GI tract, feces. So if even no signs and symptoms, you can detect virus in the stool. You can collect the specimen of the stool, and then if you find under the electron microscope, you can see the hepatitis A virus, even though patient have no signs and symptoms yet. So after the appearance of signs and symptoms, you can still can detect the virus in the stool. All right, so after appearing signs and symptoms, there is appearance of the antibody. First IgM, and the HAV followed by IgG, HAV. This is the natural cause of infection. Then recovered. So that finished. This is already I mentioned. So if you look at geographical distribution, so almost worldwide distribution, especially very high prevalence is detected, occurred in the Africa, India, Southeast Asia, Brazil. So meaning that the low socioeconomic, the developing countries, and the developed countries, very high prevalence of the HIV infection. So can we prevent? Yes, we have vaccines. HIV can be prevented by taking immunization. So activate HIV vaccine. Both active and passive immunizations are available, but in most of the countries we already have exposed to the virus since our young age. So for us, we don't need. But in the non-endemic area, in Europe and America, so those people want to travel to Southeast Asia, so never exposed to HIV virus. So in this case, they can get the adult HIV infection, very severe. They were present with jaundice. So in that case, they have to take the immunization. All right, so this is about HIV. So another one is HEV. Mode of transmission is the same. HEV virus also fecal oral route of transmission. If there is fecal oral route, waterborne transmission can. The feces contaminate water, it can transmit the same route. So because of especially India, in India there is an outbreak of hepatitis B virus in once time. So Asia, North and West Africa and Mexico, like low socio and not underdeveloped countries. And the problem is in pregnancy, if the pregnant women infected with HIV, so fulminant hepatitis, it can cause fulminant hepatitis and causing death, 20% of pregnant women. Mortality rate is high and no chronic area. So difference is for HIV, no vaccine. Now HIV, we have vaccines. Transmission is the same. All right. Then we go to hepatitis B virus. Hepatitis B. So if you look at hepatitis B virus, epidemiological distribution, so the red are high prevalence. High prevalence here. Not India. High prevalence is Southeast Asia countries, including Malaysia, and Myanmar. All. So 2 to 7 is intermediate. So meaning that high prevalence rate is related to high carrier rate. Hepatitis B and HBs antigen carrier rate. Okay, so this is a virion, hepatitis B virus. Virus is a virion. So if you look at this, virion, the shape, spherical shape, and outside the coat is enveloped. If you look at envelope, you will see circular shape, spherical shape. These are hepatitis B surface antigen. no, S protein. So this S protein may be medium size, large size, small size, no, depend on the stages. No? So whatever it is, they are surface protein. These protein are antigenic, and they are the antigenic. They present as HBs, hepatitis B surface antigen. So this is the core, no, and capsid. No, here is a cubical structure. No, the capsid is a not different structure, helical, cubical, complex. No, here is a cubical, no, structure, and this core is related to the protein. Also, these proteins are core proteins. No? The core proteins are antigenic. So these antigens are HB, hepatitis B, core antigen, and hepatitis B E antigen, not related to two antigens. Not HBC and HBE antigens are related to the core, right? So the most inner one is a nucleic acid. So nucleic acid, no, you will see that two strands, no, double-stranded DNA. So with this DNA, there are enzymes, no, polymerase, and also this hepatitis B also carry the reverse transcriptase enzyme. They use the reverse the RT during the replication process, not only HIV, but HIV is under the retrovirus group. Hepatitis viruses, B is under hepatitis viruses. All right. So this is a surface antigen, no? Or I show you the surface antigen are medium-sized protein, small-sized protein, and large-sized protein. So these are proteins. So these proteins are produced by the gene, right? So S gene, X gene, B gene. No? So they have also this gene. No? So this is a hepatitis B surface antigen. No? You can see this antigen. In the patient blood, hepatitis B infected patient blood. So these are antigens. They are protein, not the virion, no nucleic acid, only surface protein. So some are spherical shape, some are, these are piling up, forming the tubular shape. Why they are seen? Not only virion, hepatitis B surface, HBs protein are seen under the microscope, in the patient blood is, when they replicated, during replication, the S protein are produced, overproduced, in related to the nucleic acid. Now, S protein are many times not produced. That's why you can see hepatitis B surface antigen like this, in the patient serum. Now, actually, because of these are protein, because of the protein, not virion, especially regarding the message, disturb my class. So this one, because of the protein, usually found in chronic carrier, patient. So the first vaccine we used is a plasma-derived vaccine. So plasma-derived vaccine is, we are using hepatitis B surface antigen, this kind of overproduced hepatitis B surface antigen. We purify from the blood of the hepatitis B chronic carrier patient, purify the S antigen, and we use this antigen as a vaccine, the very first generation that is known as plasma-derived vaccine. So these are not included virion, only hepatitis B antigen protein. So this is not infectious form. Infectious form is, I told you, this is the virus. Virus is the virion, not including nucleic acid. Virion is infectious, right? So what are the forms? You can detect it in hepatitis B patient. So one is virion. This is a Dane particle. This is the Dane particle. That is a virion. No, Dane is a scientist name. So Dane particle. This is about 42 nanometer, the whole virion size. And another one is spherical shape, 22 nanometer, spherical shape. This is the circular shape, HPS antigen. So these 22 nanometer S antigen piling up, forming the tubular form. That is filamentous form, round about 200 nanometer long. The circular shape is 22 nanometer, 22 nanometer, 22 nanometer S antigen, combining, forming the tubular form. So these are three morphological forms can be detected in patient with hepatitis B infection. All right. So transmission, I don't want to explain anymore. You already know that. But in this case, hepatitis B is mainly parenteral, parenteral route. In case of HIV, sexual route, but both, all three routes can be transmitted hepatitis B infection. and the efficiency, so-called, transmission rate, in case of needle stick injury, you got the needle stick injury accidental, So in case of HIV, the transmission is very low, The highest transmission rate, of the three, viruses, HBC, HBV, ACV, HIV, the most infectious, and high transmission rate is hepatitis B virus. If you got needle stick injury, with hepatitis B virus, you have to take the treatment. Treatment maybe passive immunization. Antibody. You have to take the hepatitis B immune globulins to neutralize. Because of high infection rate. Okay, so you all know that this is a transmission. Who are the risk group? All right, so the same as hepatitis A virus, the outcome of infection is also depend on the age of acquiring hepatitis B virus. If the age is very young, in case of newborn just born, from the chronic area patient, you imagine this, newborn, the immune system is not developed, well developed, like immature, So in this case, exposed to hepatitis B virus, then most of the 95% of newborn, the infants born to chronic area progress to chronicity, chronicity. The immune system cannot eliminate the hepatitis B virus, in these patients, and causes chronic infection, and then causing chronic carrier. That's why these newborn infants, when they become, the 20 years, 30 years, after 20 years, they will have they will survive cancer, liver. So if the acquiring age is adult, so 90 to 95% recovered, it's okay, because our immune system mature, and then our immune cells remove the hepatitis B virus. So 90 to 95% have the acute infection. After 6 months, recovery. That's why out of 5 to 10% causing chronic carrier.
Doctor?
Yes.
I think we need to move to another session because we have like 1 minute left.
Yes, I saw that.
So we use the same link.
The same link, right?
What?
The link is
the same.
the Zoom. Okay.
Yeah, the same one. Okay, doctor.
All right. detected in the patient's serum. So that's why these are the markers. Markers is indicating this is an infection for that particular virus. So serologic markers for hepatitis B virus. These are so antigens, antibodies, and also virus, not taint particle. HBV particle is a virion. So you can detect the virion as well. But usually, when we say serologic markers, usually antigens and antibodies. But during this 6 months period, you can detect the hepatitis B virus. Not by serology, by PCR. All right, so these are the markers, as to their duration. This is a level of detection. This one is incubation period. Incubation period is around about 1 to 2 months, right? So this is a 1 month. So if you look at the antigens and antibody, you will see the green is a hepatitis B surface antigen. So very easy to detect because of the nature of overproduction of hepatitis B surface protein. So the level is very high. So that's why if you want to screen the case of hepatitis B infection, for example, like blood donors, or suspected patient, so the first test we need to request is S antigen, not E, very big. E antigen is only for those who are chronic carrier, HBs antigen positive. It's chronic carrier, the virus is replicating, meaning that infectious or not infectious, we need to request the E antigen. E antigen is indicating virus replication, actively replicating viruses. So if there is S antigen positive, you can request E antigen. All right, so if you look at here, S antigen is a very high titer, and appear the earliest antigen. This is the earliest one, in the patient with hepatitis B infection. This is the incubation period. Before the incubation period, before signs and symptoms appear, S antigen is there. So very easy to detect. So and rises, very high titer, and then after that, within 6 months, body has to clear. So here S antigen, no more S antigen. This is the acute hepatitis B infection, natural cause. Within 6 months, no S antigen. So if there is no antigen, body have antibodies. So antigens and antibody you cannot see together in most of the cases. If there is no HBs, we can detect anti-HBs, antibody against that antigen. So you see here anti-HBs. So if you detect anti-HBs, it means that this patient is recovery stage. Patient have recovered. Body remove the immune cells, remove the S antigen viruses, and then now we have antibody, that is anti-HBs. So this anti-HBs is protective. You can protect the further hepatitis B infection. So that's why this is the protective antibody. So that's why if you are taking vaccines, vaccines for the HPV vaccine, you are we are having to we are to create the anti-HBs antibody in our body. So this is a protective antibodies. Having protective antibody, we can prevent the hepatitis B infection. All right, so after that, HPE, now virus is replicating, so you can detect HPE, and low titer, and then after HPE, now HPE decline, before the disappearance of S antigen, for the short period. So you cannot catch, if you request the HBe antigen, for the screening of hepatitis B infection. HBe is only positive this period, so very difficult to catch the point, to get the positive, positivity rate. So this is the HBe, and then no more HBe, there is an antibody, anti-HBe, right? Okay, I think you can follow me. So another one is anti-HPC. So this is the antibody. You cannot have HPC antigen in the serum. This is a difference from other antibody. No HPC. Here is S antigen and the HPS. Here is E antigen and the HPE. For anti-HPC, no HPC antigen. You cannot detect HPC antigen in the patient's serum. HPC antigen is only present inside the liver cells. If you digest the liver cell, you will have the C antigen. Otherwise, you cannot see in the patient's serum. That's why here anti-HPC. So you see the highest antibody, very high. That's why very easy to detect. So anti-HPC. Right? So if it is here in the HPC IgM, IgM, this is the recent one. So IgG is a past infection, chronic in previous time, not the recent. Okay, so in case of HBs antigen decline and declining or disappearance of the HBs antigen and not appearing anti-HBs, this is the period, this period. So if you detect, if the patient is during this period, where is my cursor? Okay, now this period you can miss the patient, because this period no S antigen and no anti-HBs here. Right? So when you screen it, HBs antigen, in case during this period as antigen negative. And also you can confirm with anti-HBs negative, meaning that as antigen negative, anti-HBs negative. So this is not HPV infection. So patient is this period. So in this period, you have to request another one. So if the patient is S antigen negative, anti-HBs negative, request the test anti-HPC to exclude hepatitis B infection during window period. This period is known as window period. So window period of the cause, acute infection cause, only positive serologic marker is anti-HPC. So this is the causes, the natural cause of hepatitis B, acute hepatitis B infection. All right. So in case of chronicity, so now chronicity, so patient cannot eliminate the hepatitis B virus more than 6 months. So here, years after infection. This is years after infection. This is weeks after infection. Weeks is, this one is 4 weeks, 1 month. So 1 month, before 1 month, S antigen rise. Rise or S antigen. Actually, within 6 months, 6 into 6 months is 24 weeks, right? So here, HBs antigen must be declined, as previous figure, previous graph, acute infection. So now you can detect S antigen long time, cannot determine when, will disappear the HBs antigen. It depends on your immune system, maybe 5 years, maybe 10 years, or maybe lifelong. So HBs antigen positive rate Now, after the 6 months, this is chronic hepatitis B infection. Now, in this case, you have to do HBe antigen to detect this is the actively multiplying not in the carrier or not. So, if it is HBe positive, the patient is very infectious at that time. No? They have to take the antiviral therapy. No? And then after taking antiviral therapy, no, and then no more HBe antigen, no appearance of anti-HBe, meaning that viral replication reduced, no, the infectious rate reduced. All right, so anti-HBC total, no, IgM and IgG, no, the anti-HBC, no, also raised, no. So this is a chronic hepatitis B patient serological markers, no, positivity. All right. Oh goodness. All right. So I want you, all of you, to interpret this one. I will give you 5 minutes. No. So number one, no, the patient, no, serological marker positive is no HBs antigen negative. Now please, microphone on, or even though you are not showing the audio, the video camera. So please answer me. Thank you, Akil. So number one patient, no, is HBs antigen negative. Now you know the graph, right? HBs antigen negative, anti-HBs negative, anti-HBC negative. How you interpret?
What Doctor? Number one patient?
Number one patient here, his serological marker, no, positivity rate, no, positive result are HBs negative, S antigen negative, anti-HBC negative, anti-HBs negative. How you interpret it for this patient?
Normal?
No infection.
No infection, normal.
So this is not the case of hepatitis B infection, right?
Yes.
Not exposed to virus, all right? So that's why all negative, not exposed to hepatitis B virus, maybe normal, no? In other words, they are susceptible, right? No antibody, no protective antibody. Now first you can interpret as of hepatitis B infection, right? And also the patient have no antibody, he or she is susceptible to hepatitis B infection. So what is your advice to this patient?
Vaccine.
You have to educate the patient so to take the vaccination. Every time when he exposed to virus, he can get the infection. So can be prevented hepatitis B infection by taking vaccination. Number two patient, HBs antigen is positive, anti-HBs negative, antigen still positive, antibody not appear, but anti-HBC and IgM positive. How you interpret? What is
Recently infected.
Recent infection.
Very recent infection.
Ongoing patient.
Yes, HBs antigen is positive. No anti-HBs, meaning that patient is this period within 6 months. And again, you test is anti-HBC positive IgM. This is acute hepatitis B infection. Patient is having acute hepatitis B infection.
Wait, what's this?
All right, number three. S antigen negative. Okay, number two and number three is almost the same.
Oh my
So if
god.
it is IgG, no? So all right. Oh no, sorry. HBs antigen negative, not the same. Now S antigen negative, S antibody negative, but anti-HBC is positive. What is the case?
During the window period.
Oh, all right. Antigen positive, antibody negative, not request anti-HBC. So this is a window period right here. This period, no. So this is S antigen. This period, no S antigen, no antibody, only anti-HBC IgM. So this is patient is during the window period. At this period, you cannot detect antigen. Also, you cannot detect the antibody. But this is a case of acute hepatitis B infection, no, by the presence of anti-HBC IgM. All right. So another scenario, S antigen positive. Anti-HBC, both total, IgM plus IgG. Anti-HBC also positive. Anti-HBs negative, no antibody for S, no protective antibody. So HBe antigen positive. What is the case? No,
Infection.
HBe antigen positive, no anti-HBe.
Chronic infection with viral multiplication.
So you see HBe. Now, if there is HBe, we are requesting for the chronic carrier cases. No, so because of the S antigen is positive, IgG anti-HBC positive. No, so this is a chronic carrier stage. No antibody appears. No, so if it is HBe antigen positive, this patient have actively multiplying hepatitis B virus in the patient's serum. No, if there is HBe positive, no anti-HBe. No anti-HBe, there is anti-HBe antibody. No, so anti-HBe positive, no patient, no infectiousness, patient's viral infectiousness reduced, no anti-HBe. So number 5, because I'm inside the Prof master room. So HBs antigen negative, anti-HBC negative, but anti-HBs positive. What is the scenario? No?
Vaccinated patient. This
Sorry?
is prevented.
Vaccinated.
Patient have taken vaccination. No? So, yeah, patient has taken vaccination. This is a susceptible group, right? So after taking S antigen vaccine, patient body produce anti-HBs, so protective antibody. This is a vaccine response, no? So because of absence of the anti-HBC, if there is no anti-HBC, may be different. No, this is the infection. No, because of the patient is taking only S antigen. No, so you will have the anti-HBs only. No, the vaccinees will have the anti-HBs only. No anti-HBC. No, C is coming from virus. No, go. All right. So thank you for your response. No, here is hepatitis B virus. This is the acute. This is the window period. This one is chronic hepatitis B infection. This one is after taking vaccination. All right, well done. So I think this one you already know that. No, I don't need to repeat again and again. So what is the meaning of S antigen? No, what is positive? No, if it is positive, what indicates? No. All right. So, this is the management. If the patient, if S antigen negative, in case of S antigen negative, you have to take an anti-HBs antibody. If there is antigen negative, test for the antibody present or not. If there is antibody present, already immune or recovery stage. Both negative is susceptible, take the vaccination. In case of HBs antigen positive, chronic carrier, so more than 6 months chronic carrier, so you have to manage this chronic carrier patient. One is screening for liver cancer every 6 months, or yearly basis, by doing ultrasound, by doing the alpha fetoprotein, the oncoprotein, also enzymes, every 6 months, ALD, all the liver enzymes, this liver enzyme is indicating the hepatocyte, damage or not. So also have to educate the patient not to avoid alcohol. You already know that, I don't need to mention. So for treatment for hepatitis B infection, if it is natural cause, acute, within 6 months, you don't need to treat the patient with antiviral therapy. So antiviral therapy is only indicated for those chronic carrier, chronic hepatitis B infection, especially liver enzyme increase, HBe antigen positive. In those cases, they have to take the antiviral chemotherapy, right? So can we prevent it? Yes, we have very safe, effective vaccines. This is the hepatitis B vaccine, including hepatitis B surface antigen only. So the first batch of hepatitis B vaccine, first generation is plasma-derived vaccine. It's not good. So we are taking the hepatitis B surface antigen from the chronic carrier patient and then purify it. So now recombinant DNA technology and technology advance. We use the subunit vaccine, using the recombinant DNA technology, gene insertion, inside the vector, produce the S antigen only. So another one is antibodies, immune globulin, HBIG. This is the immunoglobulin from the human, those infected with hepatitis B infection. This is a very good passive immunoglobulin. So if you use this one, they neutralize it. Especially the infants born to chronic carrier patient, after delivery, you have to use this HBIG to neutralize the patient, the infant. So otherwise, the virus can attack on the infant's immune system. So HBIG is indicated for those infants born to chronic carrier patient, having HBe antigen positive like this, and also the healthcare personnel who have the needle stick injury with with the blood of the no hepatitis B patient. In case you have to neutralize HBIG as well, because as hepatitis B infection rate is transmission rate is very high compared to HCV and HIV. All right, so the prevention and control specific is vaccine. General is depend on the route of transmission. You cut the transmission route. So I don't need to mention more anymore. Okay, so now go to C virus, HCV. So HCV is an etiological agent of post-transfusion hepatitis. So hepatitis C infection, viral hepatitis type C hepatitis is known as post-transfusion hepatitis. At that time, we don't know about the C virus. C virus is mainly transmitted after blood transfusion. After blood transfusion of peripheral route, most of the people got the infection. So that's why post-transfusion hepatitis. So A is infectious hepatitis, B is serum hepatitis, C is post-transfusion hepatitis. So virus is HCV, antibody for the HCV is anti-HCV. no, not anti-HPC, no. Anti-HPC is hepatitis B core, no, antibody. This one is antibody against hepatitis C virus, no, for the screening of hepatitis C infection. Okay, so this is an RNA virus, no, RNA virus, and antigenically and genetically not stable. 6 genotypes, not depend on the epidemiological region. In China, in Southeast Asia, in US, different genotypes. No? And also under the genotype, there are subtypes, no? Multiple species, quasi-species. No? So very difficult to treat. No? These species are important for the treatment, no? For the choice of the treatment. No? Some of the genotype not responds to antiviral drugs, not that particular antiviral drugs. No, this is important also, not also for the epidemiological data as well as for the treatment outcome. No, this is a different genotypes. No, so in New Zealand, the Europe, and also Japan. So different, genotypes and different subtypes, and then quasi-species, All right. So this is a biological case, and the HCV. Okay. So here is, the interferon. So now HCV treatment, very effective anti-HPV treatment. So many countries are now planning to eradicate hepatitis C infection, including Malaysia. Maybe 2030, now there will be no more HCV because very effective antiviral therapy. The interferon, ribavirin, and protease inhibitor. I think Malaysia also, they are giving free treatment for your local people. Okay, so D virus is a defective virus, causes D infection, etiological agent of the delta hepatitis, only causes infection, together with the hepatitis B. Without hepatitis B, cannot cause they are not a virion, because to infect hepatitis D virus, they need hepatitis B surface antigen B virus. That's why D infection may be co-infected hepatitis B virus or on the chronic hepatitis B infection. What is the antibody? The antigen is delta antigen. The antibody against hepatitis B agent is delta. Internet problem. So can you hear me? Can you hear me?
Yes, doctor.
Yes, doctor.
Hello?
Hello.
All right. Nearly finished. All right, thank you. Because I lost. So we finish this one, no? So general of the hepatitis B infection, no, that's general. So you can think of microscopic examination, color and detect acid detection. No? So in this case, anywhere, so culture is difficult. We need a special culture, and also microscopy is also difficult. We don't have electron microscopes, no. So maybe internet problem. We better finish. All right. No? So for virology, mostly antigen detection and nucleic acid detection. No? So in case of hepatitis B, hepatitis cases, usually we detect the antigen or the HBS and the HBS, or HBE antigen, the HBE, the HCV, and the HG, and the HAV, so antibody antigen technology is important. Also, you have to know the viral load, viral amount of viruses in the patient, patient serum. You can do the nucleic acid, RT-PCR, real-time PCR. So both quantitative, qualitative. Quantitative is positive or negative. Quantitative is how many viruses multiplicating. Here HPE is just a virus is replicating, so that this. So if you the exact number of viruses for the monitoring of antiviral therapy, to do the PCR before taking treatment. Do the PCR, how many viral load in patient body. So after maybe 1 after or something like that, again do the PCR for the viral load. After treatment, the viral load must be reduced. If it is not changed, in case of hepatitis C viral infection, if it is not changed, meaning that not response to the antiviral therapy, maybe because of resistance or because the different virus strains. So this is viral load. All right. So the same reference. So what's so I think this is the end of my lecture. Any questions?
No, Doctor.
No.
If it is no, you can read again. If it is no question, I go out. I need to invigilate my students, my dear 2 students. Nakib and Izu is now invigilated by the hospitalary. After that, I need to.
So the next quiz will be until from what chapter until what chapter, sir?
You can do it now. All right, bye-bye.
Okay.
I'm finishing because now are outside. And then I have to invigilate them.